Good morning and welcome to the interview. I'm joined today by Professor Ed Dotton and Dr. Hannah Spier. We will be discussing borderline personality disorder and the differences in the ways it shows up in women and in men. Thank you for joining us, Hannah. Thank you, Edward, and good morning to you both.
Good morning. It's great to be here.
Hello.
Hannah, could you tell us a little bit about yourself and your interest in personality disorders?
Yeah, sure. So I'm a psychiatrist and was born in Norway, and now I'm based in Switzerland. And I also studied psychotherapy at the University of Zurich. And I'm a mother of 3 kids. And I'm very interested in the female manifestations of all the cluster B disorders, narcissism, borderline, because I've worked with a lot of women. And I just see this as a growing problem in society that we're not addressing. So that is why I started Psychobabble, which is my Substack of now 2 years, and YouTube channel, where I speak mainly about what we're not naming, recognizing, and patterns that we should be seeing.
What is it that you think we're not naming?
I don't think we are good enough at naming female bad behavior. Bad behavior in women. We're excellent at calling men out, for being narcissists, often when they're not, of calling men, calling out their psychopathic traits, sociopathic traits. We talk about that quite a bit, but, we'll never talk about dark tetrad traits in women, for example. We'll never talk about their Machiavellianism or their narcissism. And we are tending towards diagnosing them rather with trauma-based responses than with anything remotely similar to borderline personality disorder, which we're going to talk about today. So that's my concern.
That sounds like there's an almost sexist tendency to suggest that women are the victims of circumstance, whereas we always imply that men have some sort of intentional agency. Is that the implication?
Yes. The trauma is something that's done to you, or someone did this to you. And we prefer to look at women as fragile, vulnerable victims. That's what we're hardwired to do, rather than to say that these are consequences of personality, of behavior that's caused by personality traits.
So you said we're hardwired. So would you say that the tendency for this pattern to show up more biological or cultural, or do you think it's both?
It's both. Obviously, personality is very heritable. So we're pretty much sort of set in terms of personality. But, the environment matters a lot. So you're born with a set of personality traits, a constellation, and you can learn to tame bad impulses just as you can, try to encourage good impulses. And so that's what we're talking about. That's, I think, nature, and then coupled with what we're seeing a lot is bad parenting. We have now an environment where we're constantly sensing danger. And when we're talking about borderline personality, this is excessive neuroticism. So then imagine you have that as a set out in life. That's the biology. And then you put gentle parenting on top of that, and then you get an iPhone at 10 years old, and you feel that everything is urgent and everything is a sense of danger, and that's, you're hardwired to be extremely sensitive to negative emotion and danger. And then you've grown up with, if you're lucky enough to have a dad in the home, he's being shushed, or he's not allowed to do what comes natural to him, which is set boundaries. So you feel constantly that sense of danger, and your mother isn't present. She's practicing intentional parenting at 10 minutes at night, and instead of the hours that we need our mothers to help us soothe and regulate, then what you end up with is a pathology of emotional dysregulation, which is in essence the borderline personality.
Ed, there was something there where Dr. Spier suggested that our tendency to view women as being at effect rather than at cause, and being victims rather than perpetrators, is hardwired. Is there anything in evolutionary psychology that backs that?
Yeah, I suppose there is. There was a very interesting study by Menelaus Apostolou on selection under parental choice, and what he argues is that women are evolved have become evolved, although of course selection pressures have broken down in the last 200 years, but have become evolved to the patriarchy. So once the woman says, the man says, I want sex. The woman says, if I give you sex, I want investment. The man says, okay, if you want investment, then I need to be able to control your sexuality so I can be sure that I'm not cuckolded. And so once that happens, then the males, to the extent that they select beyond good looks and youth, will select for women that are submissive to the patriarchy. And so it will make sense for them to find those women attractive and for women to kind of become like that over time. And so you would expect therefore that we would instinctively see women as victims in that kind of way, as weaker people to be looked after, at least in those kinds of ecologies. And then you would, of course, get a situation where women who were predators would mimic that thing which the men find attractive, which is the helpless woman who they can look after. And that's what I think you see with some of these women that have BPD, and particularly if they are also vulnerable narcissists, is this mimicking of being weak, of mimicking of being someone that needs to be looked after. But of course, it's actually a strategy.
Yeah, it's weaponized victimhood.
That's weaponized victimhood. Yes.
That's what they do. It's operational with them.
It's operational with them, did you say?
Yeah, they learn it from very early on that this is, I mean, emotions aren't just something that happens to them. It's something that they use as tools to make you feel exactly what they need you to feel, what they want you to feel. They are excellent at asserting affective dominance. That's what they do in situations. And you'll notice in any interpersonal interaction, the one who controls the emotional temperature usually controls the outcome of the situation. And they are just, you can't hustle a hustler. And so they will manage to control the situation the way they want to, because, they don't really care about norms. They don't care about the sort of the self-respect that you do. They don't care about what people see. So, when they're out in public, for example, if you've had a girlfriend who's a borderline and you're on a train with her, the train is packed, when she starts to escalate on that train, there's no lengths that she won't go to. So you've already lost, right? So she controls that situation because she doesn't care about the same things that you do, right? So she's very good at establishing that effective dominance through this, amongst others, weaponized victimhood. So she'll start tearing things down, other people's luggage. She doesn't care. She only cares about controlling that emotional situation.
It would be useful for the audience members, Dr. Spier, just to iterate at this point. You are not saying effective dominance with an E, you're saying affective with an A.
Yes.
Could you tell people a little bit more about that?
Yeah, so the affect, the emotions of the moment. So you can also say emotional control, like emotional, because the borderline personality, she's very emotionally immature, right? So you have to think like you're talking to basically a toddler. They haven't learned to have more emotional maturity than a toddler. And a toddler thinks that whatever I feel in the moment, that is what is right. So I feel that this is unjust, therefore it is unjust. And same with them. I feel like you have wounded me by just disagreeing. You disagree, or, I put a boundary up, that's a punishment. So therefore that's what you're doing. So that's what I mean by that.
Ed, I know you have a thought about that. I can see it on your face.
Well, what I find very interesting, Hannah, is with women of this kind is on the one hand, as you say, one of the symptoms of borderline personality disorder is temper, and another one is mood swings. But they often seem to have it's almost like a long-term game. So it's the man may feel that he's in control, but actually she will. In my experience, they can be very subtle. It's a long-term game where, for example, very slowly they will release, information about themselves or whatever. It seems that it's planned. It's to be good at manipulating somebody. You can't just but just act in the moment, and they do manipulate, and they manipulate in a long-term kind of way, as far as I can see. So
Yeah.
are those two things rather inconsistent? It's rather strange the way that they can have bursts of temper, but yet they can very much kind of plan carefully how to manipulate people to get what they want.
Yeah, I don't think it's conscious manipulation. I think it's operational. I really think this is so deep-seated, something that they do naturally. You can do. I mean, you have the Machiavellianism, which is what you're talking about, the long-term manipulation. The borderline personality disorder doesn't have that capability, but she will gradually escalate, but because you become sort of intolerant, you develop a tolerance towards their emotional strategy. So they have to keep escalating, right? For you to give the same reaction, like with compulsive gambling. So they keep upping the stakes. So first it'll be a small crisis, and then at the end, the crisis, I call it crisis hoovering, right? Because they want to get that attention from you, that reaction. So at first it'll be a small crisis, and then at the end there will be you're coming in, you've been called to save them, they're on the floor lying there with a pill bottle. It'll be staged because they'll have called you before and you're coming in to rescue them, and so that will be sort of the end game, but it goes in stages. So yes, there's control, but also not a sort of control that they can long-term plan. That isn't it. I've so many of these patients, and they'll always have sort of lucid moments of insight, incredible insight, and then they'll get their planners and their schedules, and I'm gonna do this for this year, and this is how it's gonna happen, and then 2 weeks in, they've already given all of that up. Like so sort of long-term planning in the way that we think is not something they're able to do. Does that make sense?
Could you, sorry,
Yeah. Sorry, Rich was going to say something.
yeah, just I'll bring you in 1 second, Ed. Could you, Dr. Spier, could you please explain crisis hoovering again, as though you were talking to first-year psychology students in very, very simple terms? What is crisis hoovering?
So they'll have the cycle of the borderline, right? This is so fascinating. They'll idealize you. If you've had a borderline girlfriend, you'll know exactly what I mean. They're excellent at getting you to feel exactly what you want them, what they want you to feel. So you feel adored, you'll feel so special. And these are usually very attractive, charismatic women, right? They're very good at making themselves feel just sexually available enough at the same time as they have a sort of purity. They can convince you of their sort of innocence while being very sexually available. It's an art, but they can do this very well. So you feel like the one that she's chosen, because all the men around you are saying, wow, she's so hot, but she chose you. So you get that status. And so that's the idealization phase with the overvaluing. You feel so adored. And then because they have narcissistic traits, so they will be wounded, right? They have that entitlement. They will find a way to feel wounded, and then they'll have that crisis, that why aren't you doing what I want you to do right now? And they'll have a moment of like the train, you're standing on the train and you feel, okay, she's emotionally escalating and she's pulling people's things down and banging and screaming, and your only thought is not, is this fair? Your thought as a man is, how do I not make this worse? How do I and so you give into whatever she wants in the moment, and then she's won. Then you're sitting down next to her, she's sobbing on your shoulder, and she thinks that, oh, I won this one, while you're starting silently thinking, what the heck did I get myself into? Is this the relationship I want to have? You're starting to have your doubts, and then she senses that in you, thinks, oh, okay, and then the hoovering starts, and that's her trying to get you on that idealization train again. So that's dopamine. That's the dopamine of this adoration. And then it's either crisis, or she can make you feel guilt, or she can make you feel nostalgia. Like she'll be there on your shoulder and she's like, oh, remember that time and on the picnic, and that was so perfect, and oh, remember we did this. So she's trying to make you feel something. If you're the parent, it's usually the guilt. This is why I'm like this. You've never done this. They usually do the guilt hoovering. Or if you really, you're somewhere she can't find you, and she really has to put in the big guns, then it'll be calling you and I don't want to live, I can't live without you, I'm not going to live anymore, you have to this and that, and I'm going to have the pills in my hand. The crisis hoovering, she'll manufacture a crisis that you will respond to. And that's what I mean. In the beginning, it won't be the pills on the floor, and in the beginning it'll be something like a confession, something like this happened to me, and you'll feel the confessions and you'll feel that that's intimacy. You mistake it for intimacy because a normal person would never do that. That's always the mistake we make with these people. We think that they think and feel as we do, but they don't. So they'll tell you, whatever is necessary, and because they're so high in neuroticism, they can read you immediately. They're so good at sensing what you respond to. So that's why the next time they can do it even better, and it would be really slow drip. That's why it feels like long-term planning. But she's always calibrating. She's just, with emotions there, you cannot outdo her. Does that make sense? So that's the different types of hoovering.
It's interesting, yeah, I hadn't thought of the idea, but I suppose it does make sense that neuroticism would possibly be associated with reading people's emotions, because you'd be highly sensitive to every little move. You'd be paranoid.
Absolutely.
And thus you would almost like aspect of schizophrenia. You would overread potentially the tiniest little emotion.
Yeah, so they think that's why the micro expressions, right? That women mimic the expression by first sort of taking on the expression themselves. So women on average do that better than men, but these are much better than average at doing that. So sort of seeing every tiny little movement in your lip, twitch in your lip. So that's why she can immediately understand what you need to hear as a man from the first encounter.
And also, presumably it can provoke her as well. So presumably a micro expression of slight annoyance that anybody else would miss.
Yeah. Even you yourself haven't consciously been, because you're like, you did. I saw you did your lip twitch. You do think that, and you'd be like, no, because you haven't consciously sort of received what you were feeling in that moment, but she will understand first before you do, as the typical man. You'll be thinking logically, and she will already do her emotional reasoning, because they don't think that their reasoning, as I mentioned before, is emotional, not logic. Because I feel this way, therefore it is that way.
One of the things that I'm quite interested in exploring is that there have been some studies that talk about different kinds of borderline. And I think that often when you and I have discussed it, or when me and Richard have discussed it, what we're often focusing on is just the typical DSM. Is it 9 symptoms?
9.
And it's direct. For example, when you're saying, one of the markers is self-harm and suicide and threatening suicide and things like that. But what I find quite interesting is when it's quite subtle, when they're actually very subtle, such that it would go under the radar, that it would take you a long time to realise you were dealing with a borderline. So, for example, you can directly threaten suicide, or you can say, "Oh, you've upset me so much, I just don't want to live anymore, and I can't go on. I'm so broken," and that's kind of subtly doing the same thing. Or subtle forms of self-harm. So yeah, at least when they're teenagers, they stereotypically cut themselves or whatever, or burn themselves. But doing subtle things that are damaging to themselves, and even self-sabotaging, like just like doing something really ridiculous at work so that they get bizarre. It's this subtlety. What do you think? How can we conceive of different kinds of borderline? Like there's a study I found that talked about the high functioning borderline, the histrionic, the depressive internalizing, and the angry externalizing. And so you seem to get some of these borderlines that are diagnosed with it, but still can function in everyday life, can hold down a job and things like that. So wouldn't they be the more kind of insidious, subtle ones?
Yeah, I think that depends on how much you want to pathologize and how much you want to look at it as a more of a personality type. I in general, with all these different mental disorders, I don't like the high functioning term, because if you want psychiatry to be a medical field, then treat it as such. And we define illness as when it impairs functioning. So just this thing we have with saying high functioning depression or high functioning autism, then to me, by
Here, here.
definition, it's then we're talking about a personality type, and you can have women who are very neurotic and have had limited parental presence. They will have a lot of these sort of symptoms, if you will, or traits, even better, without being clinically diagnosed. Anyway, I mean, this, what's really the difference between dark tetrad traits and cluster B traits? If you nail it down, the difference is that with the cluster B, they have come to you and said, "I feel sick, help me." So yeah, I think it's a mistake to try to look at it too academically and not clinically, right? That's why I'm not such a fan of all these different types of borderline.
Here, Dr. Spier. I agree with you. I think it's a tendency towards excessive pathologization of perfectly normal behaviors. And people like
Hang on,
people like it.
they're not normal behavior. I mean, if you look at these the symptoms in the DSM, I can't see. Well, some fear of abandonment is normal.
It's not. Yeah, but Ed, it's not. It's poorly written. I grant you. Which should say is pathological abandonment terror, not fear of abandonment. The language is too pH neutral because they think they're being clinical and I don't know, adult about it, but they should have said a pathological terror of abandonment. And then you'd get a sense of what a borderline is really experiencing. They're not just scared of being left. It's much more than that. Otherwise, as Dr. Spier says, why is it a personality disorder? That's not a personality disorder if you're just a bit scared.
Well, no. So I suppose, yeah, it's subclinical then with a lot of these people. It's perhaps we might run into. It's perhaps subclinical if they're the kind of one that can hold down a job, let's say, then they can have or actually have a long-term relationship. Then it's potentially but they have all the symptoms.
I think that's a more sensible way of looking at it than insisting on loads of different subtypes. We should just say, okay, this is subclinical now, and maybe they're sort of in that area, but not. There's no personality disorder there. Sorry,
And also,
Dr.
I've
Spier,
lost
go ahead.
I've lost a lot of respect for the people making these. And people should never forget that these diagnostic categories are made by a committee in rooms where people, these psychiatrists, they take self-reports from a group of people who are notorious for their lack of insight. Right? So I think that has to be said, that this is, and so. And then they think, oh yeah, and this looked the same, and that. So I think a lot of this is lost in the sort of academic interest of wanting to make these categories, and they have in a lot of the new studies, they have completely excluded tattoos as a form of self-harm. And I think that's a huge mistake because I'm a clinician and I see how they use tattoos as a way of self-harm. And in many of these cases, they don't, and then they'll classify someone who has a bunch of tattoos and piercings in strange places as someone who doesn't do self-harm, because it's not classified anymore as self-harm. I've sat and they can't come on Monday morning after a fight with their mother and they've started something just horrendous just because they crave the pain. And they crave the pain because it's easier to deal with than the emotional pain.
Understood. Is sexual promiscuity classed as self-harm or not?
That's impulsive. They classify that as impulsive behavior. But I think that this is all a matter of interpretation.
Do you consider sexual and emotional promiscuity a form of self-harm?
I think that it's definitely self-destructive behavior. But self-harm, not because their intention isn't self-harm with that. They don't think long term enough to say that this is a way of harming myself. That's a way of satisfying that emotional need of attachment.
Where I'm sort of moving towards here, and I think with what I'm hearing in between the lines of what you're saying, is there are ideological factors here that are affecting the diagnostic criteria. So we mustn't see tattoos as self-harm. We mustn't see sexual promiscuity as self-harm, because the ideological coordinates we must conform to are you can be allowed to do whatever you want, and this is just an expression of your wonderful individualism that should be completely without restraint or boundaries.
Exactly. And you should go and look at the article I wrote on Substack, and also I did a video on it on YouTube where I talk about the tattoos and the just thousands of people who are so they got really upset that I'd called tattoos a form of self-harm, because people are so they want it to be culturally acceptable. Do what you want. All I was saying is that these girls have told me that they do it for the hurt. Right? And I kept saying, I'm not saying that all tattoos are self-harm, but somehow that's what they heard and that's what they read. I'm saying that they use it
Because
as it can be used as a form of self-harm.
yes, because they're very, very sensitive to shame, and they're very, very sensitive to conformity. They don't want someone spreading the meme that maybe there's a problem with this. They want to be constantly reassured, no, it's perfect and wonderful for you to do everything that you feel like doing at any time of day, while still maintaining that victimhood status. So they want it both ways. They want the victimhood status. Yes, I'm mentally ill. I'm #mental health damaged, and I can do absolutely whatever I want, and there's no indication there clinically that my behavior is harmful. Go on, Ed.
Manipulation, though, isn't it? Presumably, if at any given point, it may be helpful in terms of getting what you want, to be a victim. And at
Yes.
some other given point, it may be helpful to your self-esteem or whatever, to be a narcissistic and think that you're great and that you're wonderful. And presumably, it also. One thing is because I read a study indicating that 15% of women in this sample had practiced BDSM in the preceding year of controls, but it was like 35% of borderlines. So that's double. So they're 100% more likely to practice BDSM than controls. So does BDSM count as self-harm in so much as what they're being hit by their boyfriend or whatever, but they're kind of in control of it?
Is that for me?
Dr. Spier, that's you. Yes.
I would say that that's not self-harm. I mean, by definition, the harm is being done by the man. I would say that that's because when women practice BDSM, it's a way for them to feel safety. It's a way for them to have boundaries set. So the sexual gratification comes from that. Someone loves me so much that they're willing to hurt me for my own sake.
Dr. Spear, could I just suggest something there and push back against that a little bit? When I was a younger man, I think I would have been clinically registered as somewhere on the borderline spectrum. I used to drink and take drugs, and I did nightclub security, and I put myself in dangerous situations where I knew I was going to get into fights and beaten. And just because I recruited or manipulated situations such that men would hit me, and I wasn't hitting myself, would that not count as self-harm, really?
Maybe it also is, but I think the initial motivation is that he is so passionately in love with me that he would set boundaries for it. They feel safe through the BDSM hurt. It depends on if it's whipping with blood and all of that. But I think I don't know what sort of BDSM there, but if we're talking about spanking, I think. When a lot of these girls are very into spanking, and there's a protection in that, right? Because it's always very controlled, and the position you are in when you're spanked is very protected. You're held closely, and it's hurt that's very controlled by the man. So I think what they feel through that is emotional safety. I think that's the primary intention from the point of the woman.
Yeah, fascinating. this is approximately what the paper that I looked at said. It also said that some of them have sexual problems, like vaginismus or whatever. So it's a way of controlling their of exploring their sexuality in a way which they can control. But yeah, this another thing that I didn't. These studies vary wildly. But one study found 85%, another found 15%. Let's cut down the middle. Let's say, I don't know, 60% of them seem to have been physically or sexually abused as a child. In these studies, is that relevant? But then of course they would lie and say they had been. So I don't
That's
really understand
why.
how
That's
people
why.
take them.
Yeah. That's there's this Guardian article, a recent one, where two leading psychiatrists go out and say that we should look at all borderline as really trauma responses. So there is this active push from psychiatrists to sort of get rid of the borderline diagnosis and sort of push these patients over into this is a trauma response, and then they cite this I don't know if it's the same research, but there was a meta-analysis that said 30 to 90% of borderline patients have experienced abuse, so in childhood abuse. And if you go into that, and I took a look, it's majority psychological neglect. It's not physical abuse or physical neglect, it's psychological neglect, and that's heavily up for interpretation. And it's self-reports of they have told a clinician who's now 85% are female clinicians, who go into this field because they want to be in a rescuer role, so they do believe everything that's being told to them. So they say, I was sexually abused. That is what they practice the most, to make people believe. And so I'm not surprised at all. The other thing is 30 to 90%. Is it 30 or is it 90? If it's 30, then you're saying, what you're really saying is that 70% of borderline patients haven't experienced abuse.
That is extraordinary. Then that it's a self-report like that. That it's not from relatives, because they will fantasize about things like that. So that's a bit,
yeah. Also, they get off on it. They get off on telling men that they imagine it is the perfect thing to tell a man, because when you tell a man about anything sexual in nature, they're immediately ears up. And it puts them in the damsel in distress. Nobody's better at playing the damsel in distress than the borderliner. And so she gets two things at the same time. I'm the victim of the most horrendous crime. And men have this, you're primed for it. You're told about sexual abuse. It's not only fascinating because it's about sex. It also puts her in this, she needs to be saved by me. So it's the perfect crime, so to say.
Just out of kindness to the audience, we've hyperlinked a really important concept here, just very, very quickly. All three of us have done it, and we all three know what we're talking about. But for the audience, we've both had a wry smile at the reliance on self-reports from people we know you can't really rely on. Dr. Spier, could you just talk about that for a moment so that the audience understands exactly what we're saying?
About what?
The reliance on self-reporting from people we know pathologically are not good at telling the truth.
It's not that they are pathological liars in a malicious way. It's just that you have that poor insight, it's in the criteria, it's in the clinical description of the borderline personality disorder, that they have a fragile self-concept, they have this chronic emptiness, and so they have all of this neuroticism that makes it their judgment skewed. Right? I think that's a better way to say it than just, they can't tell the truth. That's not what we're saying. But when you have that high level of neuroticism, there are other things that are prioritized before objective truth.
So
I'll
say it.
I'm trying to say it in the most
I'll say
better way.
Yes, sure. I'll say it, and if I say anything wrong, you both can push back against it. psychology and psychology research is often woefully naive because some of the data, a lot of the data that we take is from self-report questionnaires. So we're asking the client to tell us about their reality, and then we tend to naively in psychology treat that as gospel, even though we know the person is not mentally well. That was
Oh,
the point I
sorry.
was
I
making.
misunderstood what you wanted me to say. Sort of a nicer
okay.
way of saying how borderlines tell you about their
I
experiences.
don't understand. If a borderline says that she's been sexually abused as a child, and she objectively hasn't been by any reasonable standard, that's a lie, and she knows it's a lie.
Yes.
Hannah,
Yeah,
is that
absolutely.
not fair
That
enough?
is that
It's
is,
a
that
lie.
is a lie, but I think it's also about perception. I think you know, we know that we can make ourselves believe anything. Right? We know that we've seen this in court, right? That you can be made to sort of believe that something is true. I do think to some extent that they end up believing it. They tell a lie so many times that it's in the end it's their perception of what happened. Is that happened to me a lot of times, that I've had a story from a borderliner, and they come in with their twin sister, and she'll be like, we were in that same bathtub and this didn't happen, right? And that will be after a year of me having believed that this happened to her. So and I do think that she has come to the point where she believes that happened.
But it's important that we draw that distinction ourselves as outsiders objectively. This didn't happen. So whatever's happening for the client that causes them to believe it or not believe it or know it's manipulation, we need to be able to draw the hard boundary and say, that's a lie. That's a lie. You're saying something happened that didn't happen. That's quite important, isn't it?
I think so. I think we need to be stricter.
Yeah, that's fascinating. The idea of talking to their sister or whatever, or their relative, and being told, no, this is not the way it was. It's like that woman Virginia Roberts, the person that's the accuser of Prince Andrew. And if you read her memoir, which I have done, then it's incredible what she's saying. I mean, it's incredible what she's saying.
Yeah.
That what her mother used to make her pull her knickers down and beat her in the garden in front of neighbours with the thorned twigs of a rose bush, presumably bringing up blood on every stroke.
What?
And she'd do this in front of the neighbours, apparently, right? And then and the neighbours just did nothing. I don't believe that. And it's extraordinary. It contradicts common sense that she'd behave like that in the back garden with the neighbours watching, if indeed she'd behave like that at all.
Yeah, but
And there's so many things like that.
let me ask you, like, let me put you, because I've been thinking about this lately. So I can, this isn't something that I can hear what your thoughts are on this, truly, because I think it really maps onto this. There are, I mentioned before, dark tetrad traits. And I think it might be worth separating the borderline patient from a woman who is Machiavellian and psychopathic. She would lie pathologically while knowing full well this didn't happen. And the way that would manifest in women is through weaponized victimhood, is through talking about sexual abuse. It wouldn't manifest the same way as psychopathy would manifest in a man. But I think we might be making the mistake of liking to pathologize women rather than saying that this is a psychopathic female. Right? Maybe it's worth starting to make those distinctions. Not everyone who does this is a borderliner.
No, I mean, Virginia Giuffre certainly, I mean, again, is she telling the truth? That's the thing. You could argue that even saying you've engaged in self-harm is making you the victim type, which is then attractive. She talks about having engaged in self-harm. Did she? It's very difficult to say.
That wouldn't that be handled? So if we have the idea that psychologists can be a little bit naive, if we insisted on psychologists and clinicians understanding that there is a power dynamic and it needs to be addressed directly, and we need to look at the incentives openly and directly, and that should be part of the clinician's notes. So today, Sarah reported to me XYZ. What are the incentives for her doing that? And rather than just having it left floating in the air, maybe there are incentives, maybe there aren't, define them. She could be telling the truth, but we don't know if she's telling the truth. What would be the incentive in her lying? Do you get what I'm saying? Like a more rigorous effort to be objective and boundaried in the clinical practice, would that maybe help us?
Absolutely. But you are thinking like a reasonable, logical man. And that's just not, from the clinicians that I've worked with, in different hospitals in different countries, they don't have any incentive to do that. They don't have the personality structure to do that, or quite frankly, I'm sorry, the intelligence. They want to believe everything they're told, and not just that. They've gone on to assume that when they receive a borderline patient, they go as far as to say, when were you sexually abused? Like, because they think the correlation is so strong, and so they just assume that there's trauma. She must have experienced trauma. And so they go out of their way to look for trauma in the past. They even suggest it to the patient. So she starts thinking, okay, I might have had a trauma because she says I had this thing, and so I need to go and look for my trauma. That's where we're at now. So I wish we could have what you now suggested. And I would always ask the family to come in, try to have her arranged for the family to come in, and take it as a warning sign when that never happened, when she refused to have that happen. But I can't tell you how many times that I met the family and it was completely a very different picture than what I had been told previously.
So I'm sorry to put you on the spot like this. Roughly, would that be happening 30%, 40% of the time?
That the family would disqualify, would negate.
Yeah.
That would happen every time I met the family. That would have
100%.
Yeah, because I didn't always get to meet the family, right? It was always something that happened, or they couldn't come in, or they don't want to come in. They don't like that I'm in therapy, so which would be a warning sign. But it would always be a very sort of disengaged family. So that I would meet them. What would most often happen is I would meet the family, and they'd be like, oh, we can't deal with this anymore. You're the 5th therapist we've seen.
So let's say you only meet 20% of the families, but of that 20%, 100% of them say this person they make this up. This is just a role that they've engaged in. That's
absolutely
worrying.
And it would be, it wouldn't be the abusive parents. Often they would come in, both of them, and then it didn't happen often, but I would be surprised to see a loving couple who are just very confused. I would say confusion was the top emotion from the parents who'd come in. And then people say because I talk about this a lot, and they say in the comment section, how can you possibly know a narcissist by the first meet? How can you possibly know? The parents are faking, they're obviously faking. And it's like, no, I mean, it's not that easy to fool me any longer. And you do see some signs. You do see it when you talk to someone for, let's call it, 2 hours, would come in for 2 sessions. There would be something that would, it's like, okay, this isn't quite right. But it's also, you see, the most interesting thing to me would always be, I would look at her reaction to the parents. I wouldn't really look at the parents so much, they're usually normal, but her reaction to the parents, that's clinically very relevant.
And how do they react to the parents?
They would be like a child. She would go back into that child mode, try to bait them, sit very oppositionally. She would suddenly lose 5 years. And it's very interesting when that happens when you meet if you're an adult, these are women in their 20s, sometimes 30s. Do you change your attitude completely when you're with your parents?
No,
not really.
No. I would like to kind of go back to about 1999. And just sort of stay there. There's part of me that would like to do that. But no, I don't. No.
Doesn't it indicate also that they are engaged in role? I don't know what the clinical term for this, role playing, because they're saying, oh, my parents are here, the context has shifted, now I'll be this. I'm sat with my psychotherapist. This is the context. Now I'll be this. I'm sat with my boyfriend. Now I'll be this. And it sounds to me or feels to me like it's a completely spontaneous thing. Of course, I change dependent on the context and my objectives. Is that fair?
Yeah, yeah, it's different. It's different because a therapist is to a borderliner will always be idolized. So the borderliner will try to show the parents, look, she's first place now. She's much better than you. So there'll be that trying to
Okay.
elicit that jealousy and that, look what her, they'll suddenly sit much closer to me than we usually sit. And so they'll try to triangulate. The parents are sitting, they'll move their chair and come over and sit right next to me. Like, it's just this strange stuff. So those were the things that I didn't notice that were, that's why I say more clinically relevant than what the parents said.
Yes.
So
Okay.
you can see that happening?
I'm trying to process it. It's actually very, well, it's very, very interesting information, and I'm relating it to my own experiences. And when the client shifts towards you, it's almost as though they're implying, "Do you see how frightened I am of my mother and father? But you're my safety." It's
Awesome.
that
Yeah.
sort of manipulative role play that they're engaged in,
And trying
and
to
the
get the
spontaneous
parents to,
triangulation.
yeah, and getting the parents to get angry. Like they wanted me to see the parents from like their worst side. So they try to upset them, try to bait them into a reaction, like see how terrible they are. And what you sort of see is how awful this patient then is. Like, why are you saying these things? We just want to have a normal conversation.
So how will they react when? I mean, you talked earlier about the borderline exploding in public on a packed train or whatever, and the boyfriend thinking, "Hang on, what have I got here?" How would they react behind the scenes on their own, as it were? Because you've both you and Richard used this term of weak sense of self, which I've always found a bit difficult to understand.
Ed finds it irritating.
I do. I much prefer actually a term that I came across recently in literature: identity disturbance. That for me was a nicer term. But when they're alone with themselves and the boyfriend has said, "Look, you're crazy. You've lied to me. No more." How will they? What do they do? Do you have any understanding of how do they react? What do they do? How do they deal with it?
Cry and hold them to hold them back and don't go and or throw things at them. Depending what has worked best in the past, anger or crying. But you will find that often they will delay until they are in a place where other people are, because that's where they have the most influence, the most power, because you care about what society thinks, they don't. So they will prefer these sort of public places but where people are around, where their friends are at. But the anger, the violence, or lying on the farm, this is something I'm gonna hurt myself now if you do this. So one of those two, I would say.
Right, and they'll do that on their own. They'll they'll go to their room and smash. Someone told me once of a woman he was with, and she was incredibly jealous. And he basically talked to another girl in a pub or something. And when they got home, he went into the room to find her with a book, just tearing all the pages out of a book.
Yeah.
On her own, doing that.
Yeah.
And she was caught by him doing it.
Yeah. I had one who went into the bathroom and shaved all her head off, or her hair off, not head, shaved her head, all the hair just straight off.
What extent do you think that borderline is comorbid or crossing over with just raw narcissism, but of the fragile variety?
Yeah, and that's why I prefer the term cluster B, because I don't think they're distinguishable. Nobody's a textbook narcissist, or a textbook borderliner. You will see narcissistic traits in every borderliner. It's why they get offended so easily. That's why this idealization phase will never last, because they will take offense. They will have that narcissistic injury, right? That's my opinion. I think the cluster B is a much better term. You also see histrionicism. You see that a pure histrionic person, yeah, you always see traits of also. So for the audience, cluster B personality disorders are borderline, narcissism, histrionicism, and antisocial. And I do think they map very well onto the dark tetrad traits, which are then narcissism. So it's the same. So you have narcissism in cluster B, and you have narcissism in the dark tetrad, and Machiavellianism, and psychopathy, and sadism. And yeah, I think that you see a lot of sadism in women, and especially these types, how they humiliate other women, they get off on it. You know where you really see it, where you see female sadism often? In family court. How they like to see the father rejected by the kids. They don't want to see you. They just don't want to see you right now. That's sadism. Huh?
Fascinating.
Sorry, I got lost now, but I do think it's very important to sort of look at it more as a group of things where you have a bit of everything rather than a textbook this or a textbook that.
Well, to steelman your position, we know from the data that narcissistic personality disorder is almost never diagnosed on its own. So you said nobody's a pure narcissist. Well, it's never diagnosed as a discrete, or very rarely diagnosed as just a singular discrete clinical entity. Same with all cluster B disorders. They're typically diagnosed comorbidly with other problems, right?
Yes, but then that you never diagnose a narcissist is a different reason, because they wouldn't present to the clinic because they're all fine and peachy and perfect. So the pure narcissist wouldn't come to the clinic to seek help. They don't need help. Unless, like you say, it's because it's a part of the borderline.
Yes. I think it's a very nice, functional, practical way of doing it, is to just say cluster B rather than that. I like that. Ed, do you have any final questions or thoughts before we start wrapping up, sir?
Well, would you get the same problem, Hannah, with cluster B? Would then say, oh, well, they're not pure cluster B. There's elements of cluster A.
Can just go on and on.
Not with the same issue all over again.
I think that's easier.
Have you found that to be true, Hannah, or do you think generally people sit in that cluster?
No, I think that's very well defined. The cluster A, B, and C. I think that's very well defined because they're so different. You've got the schizoid person. You wouldn't confuse a borderline with the schizoid personality. I mean, he's the guy in the woods who grows his own seeds because the world is going to end next year. Like, that's a very different patient.
What about cluster C?
With the anxious...
with things like...
Yeah. The anxious personality. Yeah. You know what? I think no. I mean, I think you can really distinguish them because the depressive personality, that's Eeyore in Winnie the Pooh, right? Everyone should be depressed. The problem isn't me; it's everyone else who isn't depressed. It's a difference between us having an anxiety disorder. That's, I have this thing, please help me with this thing, it doesn't belong to me. Whereas the anxious personality, it's, why isn't everyone anxious? Something's wrong with you. And I do think you can easily distinguish that from the neurotic, the excessive neuroticism of borderline and histrionicism, because they will have those lucid moments where they come in and they're like, I don't want to be like this anymore, and I did this. It's usually after institutional damage where they just, their whole life, and they lose their this and they lose that, and they're like, oh, but it is all my fault, and they have like one session where they go through, and this is what I need to do better, and this is what, and you think like, oh, I'm just the best therapist in the world because of this, she knows it's a breakthrough, and then the next you'll just be back to the same thing.
Any parting thoughts? Ed, I'll start with you.
Well, no, I just think this is a fascinating area, and I can't get enough of it.
No, I'd love to do this again. Dr. Spier, any parting thoughts?
Any parting thoughts? I think we just need to be better at calling this out in women, and think about the victims of people who do this, of women who behave this way. think more about them than how mean we are by calling this out.
It's wonderful. I've learned a lot and I've enjoyed this. Would you be willing to come on again and have a chat with us in the future?
Of course, and I will bring better internet connection.
Okay.
Nice. Thank
Thank
you
you
so
very
much.
much, both, for joining me. Thank you. Gentlemen, we will see you next time. Thank you.